Hello, Mrs. Smith. My name is Bradley Reinhardt. I'm a student pharmacist from Duville College. How are you doing today?
I'm doing well, thank you.
Great, and that's good to hear. So, are you here to pick up a prescription for yourself or for someone else?
For myself.
For yourself,
Yeah.
okay. Okay, so I've got your prescription here. I see that it's a new one. Just to make sure that you get the best benefit out of this prescription, do you have a few minutes to go over it?
Yeah, I
Okay.
can have a few minutes.
Great. So before we do that, I just want to confirm some of the information that we have on file here for you. I have you down living at 223 Porter Street. Is that correct?
Yep, that's correct.
And your phone number is still 716-894-2243?
Yes.
Okay. Are you currently taking any herbals or vitamins?
No.
No, you don't take anything like that? No multivitamin a day or anything?
Oh, I am taking one a day for women.
Okay. Oh, that's good to know, just so we make sure there's no interactions here. And the only medication that we have on file so far is amlodipine.
Yep.
You're still taking that?
Yes.
Okay, and you haven't had any other medications added to your list? Okay. Do you have any known drug allergies to any medications?
Just amoxicillin.
Amoxicillin?
Yeah.
Okay. So, what the doctor has prescribed for you today is atorvastatin, and it's also known as Lipitor by its brand name. So he has given you 30 tablets, and he hasn't given you any repeats, any refills on these tablets, okay? So in 30 months, you're going to have to go see your 30 days, sorry, you'll have to go see your doctor again and get a new prescription. Yeah. I'm guessing he just probably wants to make sure that it's working for you and you're getting the best benefit out of it. So what did the doctor tell you this medication is used for?
He didn't say too much other than it's to help lower my cholesterol.
Yes, that's correct. Atorvastatin belongs to a group of drugs called the statins. They work to lower the amount of cholesterol that our body makes. So that is correct. It's for high cholesterol.
Okay.
And how did the doctor tell you to take this medication?
Once a day, I think.
Once a day? Yep. So usually it's dosed once a day. You'll be taking one tablet, so that's 20 milligrams, and I suggest you take it with a full glass of water. You can take it with or without food if you'd like, and to get the best benefit, I'd actually suggest taking it at night, because our bodies make most of our cholesterol at night and in the early morning, so that should really help lower your cholesterol.
Okay.
What did the doctor tell you to expect while taking this medication?
He didn't really get into it.
Okay. So this medication is usually well tolerated. You shouldn't have too many severe side effects. It's really good for most people. The main minor side effects that I'd like to caution you about is stomach issues such as diarrhea. You may get some nausea. Another really common one for atorvastatin is headaches. So just be aware of those. They shouldn't become a nuisance, but if they are, contact us or your doctor just to make sure that nothing more severe is going on, okay?
Yeah.
I also want to just let you know, do you eat any grapefruit?
Yes, I do.
You do? How often do you eat it?
Only really when it's in season.
In season?
Yeah.
Okay, well, grapefruit actually interacts with atorvastatin, and it can actually extend the time that it stays in your body. So if you eat grapefruit, I suggest you eat the same amount. Keep it consistent. Don't change it a lot, because that will change actually the dose of the medication that you're getting. The main side effects to be aware of is any sign of allergic reaction. So that would include a rash showing up if you have difficulty breathing. Those would be reasons to stop taking the medication.
Okay.
Another major one is if you have any darkening of your urine, just keep an eye out for that.
Yeah.
Because it can cause kidney damage, so we don't want that to happen.
No.
So to store this medication, I want you to keep it in a cool, dry place, okay? So you should try and keep it away from pets and children for their safety. And don't store it in the bathroom. Bathrooms are really humid, and it can actually cause the medication to break down,
Okay.
and it won't be as effective. All right. So I know I've told you a lot of information, but just to make sure that I know you understand what this medication is for and how you're going to take it, I'm just going to ask you a few questions.
Okay.
So what is this medication for?
Lowering my cholesterol.
Okay. And what did the doctor tell you to expect while taking this medication?
That I might have some side effects.
Yep. Do you remember any of the side effects that I mentioned? The major ones I want you to remember are, be aware of allergic reactions, any darkening of the urine, and you may have some stomach issues, but they shouldn't be severe, okay?
Okay.
And how are you going to take this medication?
Once a day, probably at night, since that's the best time.
Yes, that's correct. So do you have any questions for me about the medication?
Not today.
Well, if you do, our information is on the vial. You can always contact us or your doctor. We'd be more than happy to help you out, see what's going on.
Sure.
And, I also actually want to bring up one more point. Although medication is very helpful in lowering cholesterol, there are some non-medication related things that you can do which should also help. Those include a healthy diet. You should be eating properly, trying to stay away from foods that are high in fat. Exercise is also a very important thing to remember, and that should help you out along with the medication. Okay?
Yeah.
Thank you for coming in today.
Thank you.